Trenbolone is one of the most powerful anabolic steroids available, known for its ability to dramatically enhance muscle growth, strength, and fat loss. While some bodybuilders push doses as high as 500 mg or more per week, a more moderate dose of 250 mg can still deliver significant results with slightly reduced side effects. However, even at this lower dose, Trenbolone remains a harsh compound with serious risks. This video explores what happens when using 250 mg of Trenbolone weekly, covering both the benefits and potential drawbacks. Muscle growth and strength gains at 250 mg per week. Trenbolone is highly effective at increasing muscle protein synthesis, leading to noticeable gains in lean muscle mass. Unlike some steroids that cause water retention, Trenbolone promotes dense, dry muscle growth, making it a favorite among competitive bodybuilders. Users often report strength increases within a few weeks, allowing for more intense workouts and heavier lifts. The drug also improves nitrogen retention, helping to prevent muscle breakdown, even in a calorie deficit. This makes Trenbolone useful for both bulking and cutting phases, though it is more commonly used during cuts due to its fat-burning properties. Fat loss and metabolic effects. Trenbolone has a strong impact on metabolism, increasing the body's ability to burn fat. Even at 250 mg per week, users often experience enhanced fat loss, particularly in stubborn areas like the lower back and abdomen. This is partly due to Trenbolone's ability to improve nutrient partitioning, directing more calories toward muscle rather than fat storage. Some users find that they become visibly leaner without drastic dietary changes, though optimal results still require a controlled diet and consistent training. Androgenic side effects. Despite its benefits, Trenbolone is highly androgenic, meaning it can cause side effects related to its strong interaction with androgen receptors. At 250 mg per week, users may still experience acne, accelerated hair loss, if genetically predisposed, and increased body hair growth. The androgenic nature of Trenbolone can also lead to prostate enlargement, potentially causing urinary issues. While these effects are generally less severe than at higher doses, like 500 mg per week, they can still be problematic for some individuals. Cardiovascular risks. One of the most concerning aspects of Trenbolone is its impact on cardiovascular health. Even at 250 mg per week, users often see increases in blood pressure due to Trembolone's vasoconstrictive effects and its ability to raise red blood cell count. Elevated blood pressure can strain the heart and increase the risk of long-term cardiovascular damage. Additionally, Trenbolone negatively affects cholesterol levels, lowering HDL, good cholesterol, and raising LDL, bad cholesterol. Over time, this can contribute to atherosclerosis, hardening of the arteries, increasing the risk of heart disease. Mental and emotional side effects. Trenbolone is notorious for its psychological effects, often referred to as tren rage. At 250 mg per week, users may experience mood swings, irritability, and increased aggression. Some report anxiety, insomnia, and even paranoia, though these effects are typically less severe than at higher doses. The drug's impact on neurotransmitters can also lead to vivid dreams or nightmares, disrupting sleep quality. These mental side effects make Trenbolone one of the most challenging steroids to use, even at moderate doses. Suppression of natural testosterone. Like all anabolic steroids, Trenbolone suppresses the body's natural testosterone production. At 250 mg per week, this suppression is significant, often leading to low testosterone symptoms if exogenous testosterone is not used alongside it. Without testosterone replacement, users may experience low libido, erectile dysfunction, fatigue, and depression. Post-cycle therapy, PCT, is essential after stopping Trenbolone to help restore natural hormone levels, but recovery can still take months, and some users never fully return to their baseline testosterone function. Liver and kidney stress. Although Trenbolone is not as liver toxic as oral steroids, it can still cause mild liver enzyme elevations, especially at higher doses or prolonged use. At 250 mg per week, liver stress is generally lower than with more extreme doses, but users with pre-existing liver conditions should exercise caution. Additionally, Trenbolone can increase kidney workload due to its impact on blood pressure and protein metabolism. Staying well hydrated and monitoring kidney function is important for long-term safety. Respiratory issues. Tren cough. A unique side effect of Trenbolone is tren cough, a sudden, intense coughing fit that can occur after injection. This happens when the oil enters a blood vessel and triggers a pulmonary reaction. While not usually dangerous, it can be extremely uncomfortable. At 250 mg per week, the risk of tren cough is still present, though it may be less frequent than at higher doses. Proper injection technique, aspirating the needle to ensure it's not in a vein, can help reduce the likelihood of this side effect. Increased body temperature and night sweats. Trenbolone increases metabolic rate, which can lead to excessive sweating, especially at night. Many users report waking up drenched in sweat, even in cool environments. This thermogenic effect contributes to fat loss but can also be uncomfortable and disrupt sleep. At 250 mg per week, night sweats are still common, though possibly less severe than with higher doses. Insulin sensitivity issues. Trenbolone can reduce insulin sensitivity, increasing the risk of blood sugar imbalances. At 250 mg per week, this effect is present but usually less pronounced than at higher doses. Users with a predisposition to diabetes or metabolic syndrome should monitor their blood sugar levels and consider adjusting carbohydrate intake accordingly. Final considerations. Using 250 mg of Trenbolone per week is still a powerful and risky approach to performance enhancement. While the side effects are generally less severe than at higher doses, they remain significant and should not be ignored. Anyone considering Trenbolone should prioritize health monitoring, including regular blood pressure checks, cholesterol panels, and liver/kidney function tests. Testosterone replacement is essential to avoid low T symptoms, and post-cycle therapy is crucial for recovery. Ultimately, Trenbolone is not a beginner-friendly steroid, and even at 250 mg per week, the potential risks should be carefully weighed against the benefits. For those who choose to use it, responsible dosing, proper health monitoring, and a well-structured post-cycle plan are critical to minimizing long-term harm.